On Health Her Way, we're asking the questions you want answered about your body.
Together with our female healthcare experts, we're diving into the questions that might seem too scary, too silly, trivial, or taboo. No topic is off limits.
Join us as we talk about Health Her Way. Welcome to Health Her Way. I'm Brooklyn Elbert.
And I'm Meredith Cunningham. And today we have a special edition of Health Her Way. We are partnering with American Cancer Society to talk about cancer care here on the South Plains in Lubbock and ways that we can all come together to help each other. And so I've been doing some research for this episode, and I have a couple of facts that I learned about cancer. I want to share those with you guys first. So first of all, there are over 200 types of cancers. I think I can maybe name 5, 6 tops or whatever. So 200 different types. More than 2 million people will be diagnosed with cancer in the U.S. this year alone, and over 20 million people worldwide. That is an insane number of people. So when Brooklyn says every one of us is touched by cancer, you can see now that that's true. Mm-hmm. So cancer is the second leading cause of death in the U.S., which actually I probably believed.
Yeah.
What do we talk about all the time? Heart disease is the number one killer of women. Mm-hmm. Cancer at number 2. So, but here's some good news, folks. We're not all doom and gloom on Health Her Way today. Cancer death rates have dropped by 1/3 since the 90s, which means that more people are surviving cancer. That's a great statistic. Yeah. So let's talk about the good things here today. And one of those good things here in our town is a place called Hope Lodge. Hope Lodge is a place where cancer patients can come and stay, but it also does so much more than that. And so here to talk about Hope Lodge today and what Cattle Barons Ball is raising money for, we have 3 different guests. Our first one is Ryan Lewis. She is one of our Cattle Barons Ball Lubbock committee members. Thank you for being here, Ryan.
Yeah, thanks for having me. I'm excited to sit down and talk with you guys today. So thank y'all.
Absolutely.
Yeah.
So let's kick it off and let's talk about what is Hope Lodge and who can stay there.
Yeah, so the Hope Lodge is a program operated by the American Cancer Society, and it is a program that provides free temporary housing for patients that are receiving cancer treatments, active cancer treatments, and for their caregiver as well. Free temporary housing. It's of no cost to them whatsoever. So patients who, like I said, actively receiving cancer treatments can stay there as long as they're in they live in a 40-mile radius of Lubbock, and same with their caregiver if they also live in over a 40-mile radius of Lubbock, which is about an hour drive. And I think that's really important because a lot of people, Lubbock is the closest place for them to receive any kind of treatment, but especially cancer treatment. So free temporary housing, but also, and I think more importantly is a community, cancer treatments for most people, it's just a really stressful time and can be really just overbearing in a lot. So I think having this community of people that are also kind of going through similar situations as these guests, it's a nice community for them to just be a part of and to have. So.
And how long has Hope Lodge been open in Lubbock, and about how many patients have been served?
Yeah, so the Hope Lodge opened in 2010 in Lubbock. It was actually the first one in Texas to open, which is amazing. Yes, and so they have 32 rooms, private rooms and private bathrooms. They have fully equipped kitchens, collaborative living areas, things like that, little outdoor spaces as well. They also have served they've provided over 71,000 free room nights for people that have been receiving cancer treatments. So that's amazing since it's awesome. Opened. Yes. And so, yeah. It really has had a huge impact on the community and far beyond the community. It serves people as far as, people there was a patient from Alaska that came and,
Look at Lubbock, Texas, getting people from Alaska.
I know.
Which we actually have a partner hospital in Alaska, so I don't know if many people know that. But so that's incredible that it's not just helping people of West Texas and eastern New Mexico, but Oklahoma, Colorado, Arkansas, and all those places. That's incredible.
And it's saved these families so much money too in hotel and travel costs. Since it's opened in 2010, it has saved families over $8 million in travel and hotel cost stays. So it's really amazing and just really impactful for those people.
You think about a patient who's having to take off time from work or their caregiver or both,
Right.
you know, and then there's so many other things, medications and costs, which we'll talk with Rebecca in a couple minutes more about. But $8 million, that's a lot of money.
$8 million. Yes, I know. And especially, like I said, these times are so stressful for people. The last thing they want to be worrying about is, the hotel costs and things like that. So the fact that the Hope Lodge can take that burden away from people is really amazing.
So you mentioned some of the spaces. There's a communal kitchen, there's garden areas. I think they also have like arts and crafts and things like that.
Yes.
So what are some ways that the general public, like whether it's buying tickets to the event that we're going to talk about in a minute, or like volunteering in a different way, what are some ways that they can get involved and support Hope Lodge?
Yeah, well, the Hope Lodge is always looking for volunteers, whether that's coming to help serve dinner and cook dinner for the guests, or even just coming and, cleaning up or showing your support to the guests that are there in other ways like that. So they're always looking for volunteers, and it's easy to reach out and get connected through them. So.
Perfect. Well, Ryan, thank you so much for being here. And for sharing some
Thank you,
information about
guys.
Hope Lodge with us.
Yes,
Thanks.
thank y'all so much.
We want to pivot now and talk about exactly how Hope Lodge is helping our cancer patients. So we brought in Rebecca Morrow. She is one of our social workers at Joe Arrington Cancer Research and Treatment Center, which is part of the Covenant Health Cancer Institute. And you are kind of the one that is connecting our patients day to day with the resources. First of all, help us understand what kind of different resources do cancer patients need on a day-to-day basis, like things that maybe we as the public aren't thinking about.
Right. I think you guys, just to piggyback on what y'all were talking with Ryan about, cancer doesn't just affect, the person, it affects all of their psychosocial aspects. So finances, emotional aspects, the impact to family. I mean, all of the different things that cancer really interrupts their life, it takes away, maybe their independence or, their normal day-to-day schedule. And they have to just incorporate an entirely new way of surviving and living into their daily life. And so it really just kind of throws people's life for a loop, having to coordinate all the different things, especially if you're coming from outside of Lubbock. I think just the stress that it puts on that as well, while you're also just trying to survive and fight your disease,
Well, thank you for helping ease the way of our patients and providing that support. And before we got on, you were sitting here telling me that you are BFFs with the people at Hope Lodge and that you are on the phone with them every day, if not multiple times a day.
Yes.
So talk about that real quick. Do you see that a lot with our cancer patients, that distance might be a factor for them when it comes to being a challenge for cancer care?
Absolutely. Absolutely. And, it depends on what treatment they're going to need. Shout out to my Hope Lodge BFFs, by the way. But, sometimes we have people with daily radiation, whether that's even a week up to 5 or 6 weeks. And you think about the impact on finances, as, y'all were kind of discussing at the beginning. We have a lot of wonderful partners here in Lubbock that will offer us medical discount rate hotels. But I mean, you even think about $60 a night, that adds up, let alone just wanting to have a comfortable place. I think what I hear most is the community over there, and just, you're all going through the same thing, even if it's a different diagnosis, you are impacted in a lot of the same ways. And so I think just being around a group of individuals who understand, whether that's people that are staying there or, the staff as well, they do an excellent job of staying informed and knowing, okay, how can we best support our residents that are staying right now? So I think there's a huge impact in what they provide there.
I think it's also like a huge thing because some people don't realize like how long patients are getting treatment. It could be like several years. So if they're coming to Lubbock once, twice a month, like it'll really
absolutely. Yeah. Even for follow-ups, they have to come, for scans and, kind of updates on prognosis and labs, not just treatment. You're right. It's constant that they're coming over here. So it is, I don't know what we would do without that resource, to be honest. So
How often are you referring patients over there? Like a general percentage guesstimate?
Honestly, that's a lot of my days. I speak with them at least once a week, or excuse me, once a day. Over there at Hope Lodge, I speak with the staff, Robin, Jody, Nyla, all of them, just to kind of coordinate. We oftentimes have people who maybe a treatment regimen was added that day or an appointment was added the next day and they need, immediate housing. They can't go home. They can't, maybe they're unfunded, they can't afford lodging. And so the staff over there does an excellent job of making sure that we can get people in. If we can't, we have backup resources that we can utilize, but just trying to be good stewards of our funds as well, and utilizing the community resources. They do an excellent job. So I'm probably referring, at least 3 people over there per day.
Wow.
I send, lodging requests, go through eligibility, assessments, and pretty much just collaborate with them daily. So
The last time we were over there, they talked about, possibly expanding or adding another one day. Is that something that you think would be incredibly beneficial, especially as our region keeps growing?
Absolutely. I think you hit the nail on the head with how fast we are growing. Even just this year alone, it's, kind of a catch-22 because you don't want a lot of patients with this, these diagnoses, but we have had an influx of new patients, new cancer diagnoses. And so I absolutely think we need a bigger facility or another facility. That's something that I know as social workers and even over at Joe Arrington would advocate for as well.
And what kind of feedback do you hear from patients who are using this resource?
I have never had a complaint. Like not one time. And I've been working with Covenant for 4 years now. I know one of my previous coworkers, she's been working for 19 years and she has never had one complaint. I actually confirmed that with her today. But the feedback that I get is they are so accommodating to people, whether they understand, they are so good at kind of sensing who needs community or maybe who needs to just be left alone. Maybe somebody's private or they're not feeling good and they're not all up in their space. Just additional costs, like how excellent the facilities are there. It's beautiful. The rooms are nice. They work very hard to, provide like nice, typical hotel style amenities, I think a lot of people like the community because they do things like the crafts, dinners, so we've actually had a patient who was from New Mexico. He was unfunded, and so just really struggled to provide food for himself. That staff stepped up, stocked the cabinets, made sure they had dinners pretty regularly so that this person could eat. They, collaborated, and I think somebody even donated like a few different dinners specifically just for him, just different things that he might like just with his ethnicity and background and things like that. And so it's very specific. And I think that does wonders with our patients to feel seen, heard, tended to. I think the biggest thing that feedback that I get back is just how wonderful the community is and the staff. So
that's incredible.
Yeah.
Thank you so much for coming on and sharing your insight with us. We appreciate it.
Thank y'all for having me. I really appreciate it too.
Joining us now is Beth Vance. She also sits on the Cattle Barons Lubbock Committee, and she is here to tell us about why she's gotten involved in this organization and a little bit more about this year's Cattle Barons Ball event. Beth, thank you for being here with us.
Thank you for having me.
Of course. So tell me a little bit. You have a medical healthcare background, but we all get into this organization for different reasons. So tell me, why are you part of this committee and involved?
Yes. It's really a twofold kind of situation for me. I'm kind of going back to my career in speech language pathology, specifically medical acute care. 15 years in DFW and then here in Lubbock. I really worked with a lot of patients who either were neuroinvasive type cancers or head and neck, and really saw the impact that had on themselves, that social emotional aspect that it had, and then the impact on family. And with that, trying to have nuggets of moments to improve their quality of life, but also seeing the advances that we've made as a healthcare in general. And then the other piece of that was in September of 2022, my dad was diagnosed with advanced stage prostate cancer. And he was a fighter, and he He really wanted to do everything he could. And he came from a background where he understood the importance of research and really sought out clinical trials that could potentially help him. I do truly believe it did provide him with some longer longevity. But I also saw the toll that it took. And in that, he was a true advocate for the American Cancer Society cattle barons, because he understands that the funds go towards research, and the benefit that it has on our local medical community here. And so with that, last year, he got really sick in June, and we didn't know if he was going to make it through that. And he fought really hard. And he'd bought a table at Cattle Barons, and he showed up at Cattle Barons and had a wonderful time. And he was so happy to be there. And I was so proud of him. So to be a part of that and to see that personally, I truly see the impact.
Mm-hmm. I think a lot of us, I also sit on the Cattle Barons Ball Committee, but we all have our personal testimonies too, but it's so wonderful to be a part of this organization because we get to learn more about the impact and the things that we do. So the research, the things like Hope Lodge. Tell me, what have you learned about Hope Lodge or ACS since being involved?
Well, one big piece was with the Hope Lodge of how they provide that free type of amenities for patients and their caregivers. And that it's such a big burden, just like Rebecca and Ryan had talked about. And it was something that I personally saw with my dad going down to San Antonio for treatments. If we didn't have family down there, we would have been looking for options and looking at social workers for assistance. And a lot of people don't have people that live in this community, but they need to be here for their medical treatments. And so the Hope Lodge provides that. And the type of care that they provide, they really provide a sense of holistic care in the sense of, it's a sense of community. You have people that are there going through similar treatments, maybe different treatments, but they're not alone. Caregivers connecting with caregivers, having a space that they can come to and relax. Their beds are Tempur-Pedic because they understand the importance of these patients getting quality sleep and their caregivers, and having quality meals, home style meals that they can come back to that are nutritious while they're going through treatments. And so that really provides a sense of holistic care that sometimes their treatments they're getting at the cancer treatment centers can't provide just because of limitations.
So can you tell us a little bit more about the Cattle Barons Ball, what it is, and what the community can expect this year?
Yes, this year is Ranch Revival, and it's going to be underneath the stars at the VA Ranch again. It's the 44th annual. We're super excited to have Wade Bowen as our main artist, and then we'll have DJ T8 for the Ranch Revival after party. And it is going to be just a really great vibe, and enjoying the dancing and everything else that comes with that. It is 21 and up, so it's great for date night, going out with friends and enjoying that event. There's some really great silent auction and live auction items. The live auction is always entertaining. It's fun. And then there's going to be some children challenges as well as wonderful music in between the live music, and as well as wonderful food. We're super excited for this year. There's also going to be a golf simulator for the guys who want to play golf and have a few challenges as well. So there's a lot of things to do while you're out there.
And why is this event specifically so important to American Cancer Society and Hope Lodge?
It's one of the biggest fundraisers for American Cancer Society. And the Hope Lodge, all of those funds they go directly to Hope Lodge for that special paddle raise this year, and that stays here in Lubbock. And those funds help support our community, our people that are coming here for treatments, and help the medical community continue to bring clinical trials and advanced research in Lubbock specifically, so people don't have to travel that far.
Well, that's great. Thank you so much, Jo Beth, for being with us. We appreciate it.
Yeah. Thank you.
Thank you.
So this year's Cattle Barons Ball is on Saturday, July 25th at the V8 Ranch with special musical guest Wade Bowen. It's always a good time. Tickets and sponsorships are on sale now. For more information, we will provide a link for you. And of course, you can follow Cattle Barons Ball Lubbock on social media to learn more. We hope you enjoyed this special edition of Health Her Way. We will be back in the fall for season 3. Stay tuned for more on that. Thank you to our guests and our partners at the American Cancer Society and Cattle Barons Ball of Lubbock, and we will see you next time. Thank you all for listening to this episode of Health Her Way. If you enjoyed the conversation, be sure to follow the podcast wherever you listen and share it with a friend.
If you have questions or topics you'd like us to cover, connect with us on Instagram or Facebook at Covenant Health, and we'll see you next time. This podcast explores health-related topics with experts in their specialty for entertainment purposes only.
The information shared and discussed should not be considered as medical advice under any circumstance and is not intended to replace professional medical advice.
The views expressed do not reflect the views of Covenant Health System. For questions related to your personal health, always contact your physician.